Hello everyone, my name is Thomas Averill. I'm a undergraduate student here at the University of Texas at Austin. Today I will be conducting an interview with Leo Branvold, and we'll be discussing his job and kind of the undergraduate studies that helped him get into that job field. So without further ado, Leo.
All right. So, as he said, I am Leo Branvold. I'm a clinical pharmacist that works at St. David's North Austin Medical Center. My job is to be an ER pharmacist as well as an organ procurement pharmacist, which is a new service that we started. And I'll be answering some questions for you today.
Okay, so the first question I have is, can you just describe a typical day in your job field on both aspects of your job?
Sure. So, my main role it is to be an organ procurement pharmacist. That's what they hired me for. What does that mean? That means that I keep viable all of the brain dead patients that are able to donate their organs. They will go to what's called TOSA, which is the Texas Organ Sharing Alliance. It's a statewide and nationwide program where we basically work together to give transplant teams around the country viable organs. My primary role is to make sure those bodies stay within a certain limit, living questionably, where I am able to secure their organs for certain patients. My secondary role is to be an emergency pharmacist where I work at North Austin Medical Center. And that constitutes me being able to treat emergent cases, anywhere from complicated infections to making sure that the logistical parts of the emergency room are being kept up to date. So,
Okay, and within that you had to do at least an undergraduate, correct?
yes, sir.
Can you describe roughly any undergraduate education that helped you get into the career field you're in now?
So, to become a pharmacist, as an example, you need at least a year of organic chemistry and a year of general chemistry. When I went through these 2 years of rigorous math and fun times, I realized that definitely I wanted to do something in the healthcare field. And as a pharmacist, we look a lot at the drugs and how they work, what their true role is depending on the patient. And that made me realize that there's a lot more than just knowing some chemistry to be able to apply it to a patient. And honestly, when I realized that pharmacists kind of tend to be more on the chemistry side of things, it made me realize that would be the right course for me as far as like graduate degree.
Okay. And then with that, looking back, is there any advice that you would give into like a younger version of yourself or the undergraduates here at UT Austin to help them for the future?
Absolutely. I think you should ask questions, first of all. Like, there's a pre-pharmacy organization here at UT, I believe, that you can actually be a part of if you have questions about being a pharmacist, where it will tell you everything from all the things that are prerequisites for pharmacy school, including to what does the future look for you if you become a pharmacist, which is quite vast. One thing I would have told myself is, you're going to be working with dead bodies. Nobody told me that. It was going to be, I was like, no, I'm just going to work with drugs. And I thought that was really funny. So coming out of school, did it prepare me for that? No. I had to learn on the spot, and I had to be brilliant, and I had to help the physicians and the nurses because they also didn't know what they were doing. So my expertise, knowledge, and initiative came to be quite an amazing part of my role. So I will tell you nowadays that even if you go to school, doesn't mean you're prepared for it. But if you are able to learn and be a part of the team, you'll be great.
And with those learning curves, is there anything specific that stood out to you that helped you the most get through those learning curves?
Yes. Real life experience. If you have any previous life experiences and job experiences that will help you mold you into being a hardworking person who's also intelligent and wants to do better, absolutely. I always look back into my military experience because I feel accountable, I feel responsible, and I feel like What I learned back from the military definitely helped me be as successful as I am today. But it doesn't mean you have to be in the military to be as successful. It's more like it gave me the experience to be here and be successful, if that makes sense.
Yes, thank you. And then I'm gonna get back to your jobs, specifically administering medications. What kind of medications and treatments are commonly administered in the emergency room, and how do you stay up to date with all the protocols for those drugs?
Okay. So, fortunately, it goes by hospital to hospital. My hospital, to be specific, it sounds a little funny, but we're in a more richer kind of culture, which means there's a lot more overdoses and a lot more dog bites, bat bites, and things of that nature that are emergent. So patients will come in with that kind of symptoms, which are a little bit easier to treat. But when it comes to emergent, we have things like gunshot wounds, multiple vehicle collisions, and patients who are found just not breathing, like in their houses or maybe outside somewhere. Those patients require things like norepinephrine, epinephrine, phenylephrine, other medications that bring up their blood pressure in order for us to be able to save them and then kind of reassess where it is that they are and how we can further help them. Those medications are definitely the most important part when it comes to those patients. Sometimes we will have patients who are overdosing on things like Tylenol, aspirin, or other medications like benzodiazepines. We try to salvage their liver by giving them infusions of like acetylcysteine as an example. So how do I keep up with these protocols? Actually, this is an easy question because now, since I became the ER pharmacist, I'll be writing a lot of those protocols. So as things change depending on how we run the medicine, I'll be working with the physicians and the hospital itself to make sure that we update those current protocols, if that makes sense.
And then, with working with all those other people, how do you collaborate with others, such as the doctors, the nurses, to ensure that the patient's care is optimized to the full potential?
So at North, as an example, all the nursing staff, they have walkie-talkies. And, a few weeks into my role, I realized that for me to do a better job, I had to be able to communicate with the nurses. They gave me a walkie-talkie, so I'm actually a part of the nurse network at all times. And also the physicians that work literally outside of my job, like my door. I have like a little med room where I'm sitting at. They all come in and tell me, hey, Leo, we need help with this patient. There's this X thing going on. How can we treat him? How can we get him out of here as soon as possible? And so that tells me that, I'm just one door away from physicians, and I'm constantly knowing exactly what nurses need to do, which makes my role a lot easier and a lot more successful. And I feel like collaboration is quite important when it comes to the emergency room with me.
And would you say for undergraduates like myself that collaboration in the classroom is the key to success if we want to be able to be more successful in the future?
Can you ask the question again?
Sorry.
I'm sorry.
For undergraduates like myself,
Uh-huh.
some of us haven't had a lot of collaboration. Would you say that in your undergraduate studies that should be something that we kind of focus on to be more successful in career fields that involve healthcare?
So I agree with the fact that you need to be able to maybe shadow people. Now, becoming an ER pharmacist, that's very specific. So I would say that if you're able to see as many professionals as you can while you're still an undergrad, it will help you, I guess, maximize your time and realize which part of a profession actually you like the best. The more experience you have and involvement you have will give you a better idea of what it is where you would feel most successful and happy. Because at the end of the day, becoming a healthcare professional out of necessity is not always the same as being like actually wanting to do the role. So the more you know about a role, the better you're going to be equipped to be able to be happy doing it.
So kind of finding your passion within whatever field, just similar to sports, just get out there and feel out which one feels best for you and then try to hone in on that throughout your undergraduate. So
Absolutely.
perfect. And then what is the most challenging aspect of your job, whether it is getting your organs and procuring those, or the pharmaceutical side? What would you say would be the most challenging? And then on top of that, how do you handle those challenging aspects?
Okay, I'm gonna give you a quick example. When I accepted this position, I was not aware that there's gonna be a real emotional connection to it. Okay, so I'm gonna sound a little cheesy, but I'm gonna tell you a real life experience. Very recently, last week, I had a 32-year-old male who did cocaine once and was found 8 hours later with a stroke. So, for the very first time in my career and in my job, I realized that I'm taking care of somebody who's the same age as I am, and it was very difficult for me. But it also made me realize how important my job is because I'm helping 12 to 20 patients get their organs after him. He was a very healthy person, other than that. So I would say that sometimes your job will take you into turns that you don't even realize, and you have to realize the part of it that makes it real for you. Um, but at the end, it was a good case, and I love my job and I love helping people, and I'm for sure doing the role that I was assigned to do. I don't know if that answers your question.
Yeah. And how do you kind of get over those very emotional issues within your job, or the very emotional times in your job? What's your way of managing that stress on your body?
Well, definitely being able to get a good night's rest is very important. I work 12-hour shifts overnight, which kind of flips my schedule when it comes to sleeping and being able to have my regular life accounted for. Having someone maybe close to you, boyfriend, girlfriend, whatever, it does help. That support you cannot have enough. Um, and then realizing what it is that you actually signed up for and how you're actually changing the world, whether it's one body at a time, one patient at a time, or multiple people at a time. It will definitely help you realize what it is that your job is. For me, as an example, never thought I would be doing something like this, but I'm very proud of my role. And it's something new that we started here in the state of Texas. And I can tell you that it's already blooming. And I'll be teaching future students how to do this role because it is quite interesting and helpful for medicine all around.
And then with everything that's put on your plate at work, how do you prioritize what comes first necessity-wise in that high volume?
Now, the good thing about being a pharmacist is if you're here, let's say from 7 to 7, you're here from 7 to 7. So as long as you make it in time and you do your role, you get to leave and not be on call. So that means that if you have other priorities in your life that you want to take care of, you can definitely do that without it like harming your career. You just have to be um, organized and be able to have your priorities set in stone as far as like time wise. One thing I will add is when you're doing 12-hour shifts, it is quite difficult for you to do anything else other than sleep. If you prep meals and like to go to the gym, I'll tell you right now it's quite difficult, but possible for sure.
Just effective time management to the extreme, apparently.
So college definitely helps
Yeah.
because you're basically doing stuff all the time.
Okay. And then for you, can you discuss any training or certifications that you had to go through to get to get into the door for either side of those jobs?
Yes, so I definitely had to get like IV compounding training, and then I also had to get what's called ACLS, which is when a patient is coding, meaning they cannot breathe. You need to be able to understand what it is, what you're doing, as far as like CPR, stressors or pressors. I'm sorry, and other medications that go into it. As a pharmacist, I have not touched a patient, but I am qualified and ready to if the case would come. My main role is to make sure that all the patients that are being given to these cardiac arresting patients are given on time, which is actually the biggest difficulty in any kind of cardiac arresting ever. So it makes pharmacists quite useful when it comes to things of that nature. Now, other licenses, I mean, I am a licensed pharmacist here in the state of Texas, but there's also something called PALS, which is for pediatrics. So I'm actually certified to go to pediatrics, adult coding, so like cardiac arrest. And it's funny because you think like kids don't really cardiac arrest. Yes, they do, quite a lot. So that makes me a very useful tool for the hospital. I also do NICU, meaning neonatal critical unit. They also arrest. So when they're stopping breathing, I also go and help. So all the certifications I have to get in order for me to have my job.
You're similar to like a jack of all trades. You can help out in a lot of areas within a hospital, make yourself very vital to them.
Yes.
That's good. And for those, for the organ procurement, is there any procedures that you have to go through to procure the transplant and then get it to where it needs to be? Any specifics?
So my role with the organ procurement, to be specific, is I need to keep it alive because I mean the body is no longer a person, unfortunately. Secondly, my main role is to have all of the antibiotics on board, and there's something that we call renal adjustment. A lot of the antibiotics are renally adjusted based on your kidney function, so it comes up to my judgment on how we treat those bodies with the antibiotics. So that becomes my most important role because sometimes we will take 2, 3, 4, 5, or 6 days for that body to be ready for like surgery. Meaning when they go into surgery, they will actually procure the organs. But till then, it is my number one priority to make sure that the body is not riddled with, as an example, bacterial infections, viral infections, fungal infections. So I'm keeping those bodies viable, aka healthy, until the transplant team allocates all of the organs. It's a very complicated process, but it is interesting from the pharmacy perspective.
And for us, since we're in biology, how do you keep those viruses and bacteria out of the organs that you're trying to keep alive, essentially, for as long as you can?
Okay, so that's a very good question. So we take CBC, or complete blood count, every 6 hours to kind of see where the patient is at as far as like their immune system. Depending on what that tells us is how much more aggressive I need to be with the antibiotic that I use. And I say antibiotic, it's antiviral, antifungal, antibiotic, any kind of treatment that will prevent any kind of infection. Because at the end, if they get infected, then that might risk how well we can allocate those organs to a patient or to someone who's been waiting for an organ for 3 years. So my job becomes that much more important, knowing that it's going to help someone who's been literally waiting for this for a long time.
Okay. Well, I want to thank you for coming out and sharing your experience in what is essentially a new field within the emergency room that allows you to do multiple aspects, essentially. Are there any other things that you want to give as words of advice or anything about your job that you could tell the students that'll be watching this in the future?
I think that if you're thinking about pharmacy, you should definitely look into a lot more about what we can offer. UT is a great resource as far as like what pharmacists are doing nowadays. And at the end, you just gotta focus on your prereqs and be able to get into pharmacy school if that's something you want. But pharmacy as a profession is quite diverse and there's a lot you can do. And if you ever have any questions, I mean, I'm gonna let Tom have my email, and you can always email me if needed
Okay, perfect.
as well.
I want to thank you for your time, and as Veterans Day is coming up, thank you for your service, because it seems that it had a effect on you going forward, being able to manage time properly and work with others. So thank you for everything you've done, and of course, thank you for coming off this interview.
Of course, thank you for having me.